Good afternoon, everyone. Welcome to the COVID-19 vaccine webinar. With you is Nancy Mourad, Head of Disease Prevention at the MetLife for the Gulf region. And I'm very excited to have with me today two experts in this field. So from Beirut is joining us Dr. Shadi Saleh, who is the founding director of the Global Health Institute at the American University of Beirut. Welcome, Shadi, also professor of public health, health systems and financing at AUB. And from Dubai, Dr. Zartash Khan, joining us from the Clemenceau Medical Center. She is a frontline actually worker dealing with COVID-19 cases at the time. Thank you so much for joining us. Dr. Khan is an infectious disease specialist, as you may have seen in the invite, with also before joining Dubai or landing in the UAE, several years in this field in the States, in Ohio in particular. We're going to start with Dr. Shadi, actually. Shadi, you have accompanied this situation for many months now. Before we even jump into talking about vaccination and the specifics of what's in the vaccine, what can you tell us about the situation today? Where are we? It's been, in the UAE, we've been having record numbers since the beginning of this pandemic. We know in Lebanon we have similar situations. In the US, around the region, I would say we have been going into waves. Where do you think we are today, and what is your view on the phase forward?
Thank you, Nancy, and thanks for everyone who is attending. Definitely a pleasure to be speaking to you today. Thanks, Nancy and MetLife, for the invitation. So definitely this is sort of, we are in somewhat of perhaps seeing the light at the end of the tunnel with the vaccination. There's a race now between the ability to vaccinate, challenges in both supply and demand, and we will discuss this a little bit further, and compared to the surge of cases that we are seeing globally. The two key things to keep, if I was to advise on what are the two key things to monitor now, the first is the health system capacity, to deal with the surge. Do we still have beds, ICU units, ventilators, and so on and so forth? And the other one is the speed in which we are able to vaccinate populations. So obviously UAE is one of the leading countries globally in terms of rate of vaccination. But definitely there are other countries that still are trying to figure out how to do it in order to reach a level where at least the health system can breathe. So in summary, two things we need to keep an eye on: rate of vaccination and health system capacity to deal with the current surge in terms of cases.
Brilliant. Let's talk a little bit on the way forward. So the first one, the prevention, is what will keep us from saving, let's say, the healthcare system from further needing to be dealing with cases. And the second element that you mentioned is obviously the vaccination. So let's talk a little bit about vaccination. There has been, obviously, it's the topic of the year and the season. And a lot of talk has been happening around clinical trials and, could we have cut any corners for the vaccination? Can we talk a little bit about, generally speaking, the clinical trial process, and how do you see it happen this time comparatively to the past? And what is your general judgment on what has happened?
So I think let's go straight to the issue that many people are talking about, which is basically, is it true that the clinical trials that have specifically happened for the COVID-19 vaccines, have they cut any corners in terms of safety, efficacy, and so on and so forth? And the simple answer is no. Remember, and Dr. Khan will speak more to that from a clinical background. Remember that the virus itself virus. So this is one. So one, there has been work on it and familiarity whether this is the latest iteration of the virus. So this is one. Secondly, all of the current infrastructure that has happened in the previous few years have allowed for a fast scientific advancement in terms of developing the vaccines. Usually vaccines go through 3 phases. Phase 1 for safety, few people. Phase 2 for efficacy with an eye on safety. And phase 3, which is really a large number of people. So it's just important to mention that for phase 3, for example, for Pfizer and Moderna, the number of people engaged were, I think, between 30 and 45,000 people for each of the 2 vaccines, which is a huge number. So this is one. Secondly, whenever you're developing a vaccine, you need a large amount of people who have the disease and who are willing. Fortunately for the vaccine world, the number was there. We had a huge number of people with COVID-19 or exposed to COVID-19, and most of which within the community were willing to do that. So this is the second thing in terms of the phases. Thirdly, many people are concerned about the side effects. Throughout the history of development of vaccines, the side effects were mostly seen between 30 and 45 days, or 25 and 40 days. Whereas both the FDA in the US as well as the European counterparts gave 60 days window before the approval of the vaccine just to make sure that things are fine. So all of this, the infrastructure, one, the number of people who had or were exposed to COVID-19, how many of them were willing, the fact that Corona was, as a virus was already there, and this is a third iteration. And fourth, also the infrastructure that was there for vaccine development. All of these were important factors, and perhaps we can top all of this off by saying, because countries were willing to invest so much funds at the get-go, then this investment in funds injection even early on was definitely a factor, because you'll have some skeptics say, why, and we have to be honest, why a vaccine was not developed for, say, Ebola as fast as COVID-19? The simple answer is that COVID-19 affected not only poor countries in Africa, it affected rich countries in the global north, in the US and Europe. And these countries have money and they want to protect their people. So that's why they put money into this and, made the whole process faster. So a very clear answer that no scientific corner was cut for the approval of the COVID-19 vaccines. I'm not saying that every single vaccine, but at least the ones that we all know, such as Pfizer, Moderna, the Chinese vaccines, Oxford, AstraZeneca, and others.
Because also there are many bodies who are, the health authorities that are also reviewing these results and collectively agreeing that they are, as experts, that they are needing, if you want. So it's not that we're just relying on the producer of the vaccine, but also the many health committees around the world who are reviewing them, whether the FDA, whether the UK, whether the locally we have, the WHO, and so on. So I think that would all funnel back to, to your point. We will also talk a little bit more about the messenger RNA technique, which was one, I would say, breakthrough that further accelerated. We'll talk with this a little bit more with Dr. Khan. Accelerated also the production compared to the traditional methods, and it's actually a beautiful promise for the future for many other diseases. But even before that, so let's talk a little bit about this whole, people are hearing everywhere, herd immunity, herd immunity. What is herd immunity exactly?
So herd immunity is basically when you have enough people that are protected from the disease itself. That can happen in one of two ways. You either have enough people who contract the disease, or you have enough people who are vaccinated. Now, the problem for scenario one, the problem with COVID is that currently, globally, we have 2 million deaths. Actually, it's more. It's around now 2.2 million. And the best estimates are saying that between 15 to 20% of the global population has gotten COVID-19. So that means that for us to get real herd immunity, we would need to reach 8 to 10 million deaths globally. So the question is, do we want that? So this is one. And also with scenario one, as we now know, even if we got COVID, it doesn't mean that in 5 to 8 months that we won't get it again. So the whole track of people saying, let me get COVID-19 and get over with it, that does not work from a herd immunity perspective on the long run. So the solution that makes sense that was also applied for measles and polio and others is to get the vaccine and to reach herd immunity, having enough population get protected from the vaccine so that it doesn't spread anymore is between 50 to 90%. Most are saying that we need to reach around 80% of that. So 80%, if we hit that point, that means that at least we are confident that the community spread of COVID-19 is minimal to a level that does not threaten individuals and communities with this much hospitalization or this much death.
Great. So we're basically saying that not taking the vaccine could lead to, if you want, not taking the vaccine collectively would lead to many issues. It definitely would lead on a community level and the healthcare burden side to an issue. The second issue, as you rightly mentioned, is that without vaccine, it's not necessarily confirmed that our innate, let's say, or natural immunity would be able to last or be strong enough to curb it on a community or population level. And I would also probably look at the individual's side. So nothing is we have seen from a huge number of samples in the community, like you said, the incidence rate is very high, that even the younger ones or the ones who were not typically looked at risk groups also faced sometimes consequences on their health, whether long-term, we start seeing, people still suffering after 10 months, or people that lost their lives because they basically lost the battle against the virus. So whether from community perspective or I would say individual, to your point, the herd immunity is really, the vaccination is really the answer to that long-term herd immunity. The question...
If I may add a point, to be also practical, it has to be clear that, we have to live with COVID-19, right? So moving forward, it has to be viewed as, a sort of a deadlier format of the flu. So even the vaccination, it doesn't mean that we will take the vaccination for once in our lifetime. Most probably it will be something similar, and I know Dr. Khan perhaps will talk a little bit more about this. The vaccine for COVID-19 will probably be very similar to that of the flu, where we take it every year, every couple of years, especially in areas where, flu is common. And so from a disease management perspective, your portfolio, this will become part of disease prevention, and part of the annual disease prevention efforts that human resources, people who deal in public health, global health, have to adopt.
Thank you, doctor. That's a very important point. I guess as you mentioned, we're left to see how this will evolve. Seeing already the virus has been mutating. We've seen multiple variants. Initially, the scientific community and the governments went out, and there was a reassurance that the vaccine would not alter, if you want, the new variants will not alter the efficacy of the vaccine, mainly because the initial variants were looked at, and we saw that they are more virulent, so they can spread faster, but they're not more notorious, let's say, or harmful. And recently we started also hearing another view, obviously, as we see more data and experiment on the ground. So what is your view on these variants, and should people still take the vaccine irrespective of what's going on?
So currently there are 3 variants. There's the UK one, there's the South African one, and there's the Brazilian one. So in these 3 variants that all of us have to keep an eye on, because at least for the UK, not only does it spread faster, but there have been recent talk about it being 20 to 30% deadlier. So this is bad news, which means that, we have to continue to be vigilant in terms of prevention and so on and so forth. No, the good news is that at least, out of the companies that went out and discussed this, both Pfizer and Moderna said that the current vaccine protects against the UK and the South African one, and they're waiting on whether the Brazilian variant is also protected also as part of the current vaccine. But at least those 2 variants are already taken care of with the current vaccine. And this is something that we have to globally understand what's happening now. And this is why perhaps you hear that some of the companies are, in their production, they are being really sort of careful about not overproducing, simply because they want to make sure that as they are producing, that if new variants come, it is factored in the modification of the vaccine itself, so that new production lines take that into consideration. They don't want to produce 5 billion doses and have to throw away 2 or 3 billion doses because the original vaccine does not factor in the new variants. So that's why we see globally a little bit of a carefully studied supply to make sure that whatever new production takes into consideration the variants that are happening. But definitely, up to this point, the current vaccines do protect, at least for the UK and South African variant. The Brazilian one, they're still studying, but there's nothing to be worried about at this point.
Thank you, Shadi. We're hearing some questions. I don't know if you have the answer to this, or Dr. Khan, about the Sinopharm. Has the Sinopharm company released any similar data as Pfizer and Moderna regarding these new variants, and how this could affect their effectiveness or efficacy?
So far, I haven't seen a formal announcement from Sinopharm on this, but I think that since the technology that is used is that, and Dr. Khan will tell us more, deactivated virus, I think, and please do not quote me, that Sinopharm continue to take account these variants. But again, do not quote me. The thing that I am quite confident about is given the formal announcement from both Pfizer and Moderna.
Thank you. Dr. Khan, anything on your side on this topic?
Yes, sure. Speaking on this context, in the making of the vaccine, it was kept in mind that this virus is going to act like influenza and it's going to mutate. And certainly, there is more and more data. And recently there was a published article that said it actually tested a handful of people, I think 20-some people. Their sera was taken after they had had an infection from the variant strain. And the vaccine was used to neutralize, and it showed that the vaccine neutralized the virus. So it is certainly kept in consideration. So, and that's why these companies are saying that this vaccine is speculated to be effective against the mutant strains also. So this shouldn't keep you from getting it. About the Sinopharm vaccine, I don't have any data, but generally speaking, it's the whole virus basically. In the making of the mRNA vaccine, the spike protein was coded, as you know, and in the Sinopharm vaccine, it's the whole virus that is killed. So if the spike protein is mutated, there will be the RBD or another target point that will you will still have some protection. So I would say that just like an influenza, we know it mutates every year, and the last year we had about 45% efficacy of the vaccine. Yet we know that it will provide you some protection from the illness. If you were to acquire the disease, you will be partially protected. That's why they're saying both Sinopharm and Pfizer and Moderna, even though Pfizer is 95% effective, Sinopharm 79%, yet they are both 100% effective in preventing the severe disease.
Thank you, Doctor. I think I was having a voice issue at the end, but I think the point is clear. So if I may summarize, basically the idea is really a vaccine is better than no vaccine, right? Even if it's the minor version of the protection. And we're obviously all together still waiting and watching to see what such let's say, mutated version could have as an impact on the efficacy of the existing vaccines, and if and when maybe future years and new vaccine generations would come, simply like you mentioned, Dr. Saleh, like the flu. So maybe to shed a little bit more light on the flu topic. So the flu, simply we take a vaccine every year because the flu virus managed to adapt and change every year in order to survive. So our immunity has a memory, but if the virus changes, it doesn't have the immunity for the new version. So we would need to immunize ourselves again. So in hopes that the coronavirus version would remain under control, we're yet to see. The question of probably everyone from a lifestyle perspective, if I would go back to you, Dr. Saleh, on from a public health and lifestyle perspective, what would change in our life, let's say in the next 6 months, when it comes to if we take the vaccine? Should we stop wearing the mask? Should we stop doing the social distancing? Can I go travel and hug my parents? And will everything go back to normal? And if not, when will this happen?
So hugging your parent if you are all PCR negative should be fun. But again, remember that even with the vaccine, as Dr. Khan said, because of the variants and we're still studying, the vaccine will, almost all of them, will continue to protect severe cases. However, if you are you may still carry the vaccine, and Dr. Khan can correct me if I'm wrong. You can still carry the COVID-19 and transmit it, but without you feeling the symptoms or getting affected, because your body already have been able to identify the virus and generate antibodies. Until we reach a point where we do have herd immunity, where the transmission, even without adverse effects, the transmission within the society is minimal, we cannot go back to normal life. My expectation for countries like UAE and other countries where there's an active vaccination campaign, I'm guessing that will easily, need at least until late fall of 2021. For other countries where the rate of vaccination is lower, I think it will take a good part of 2022 as well. But to be specific for UAE, I think we have to be vigilant for most of 2021, at least until the fall. And remember, even then, UAE is a country that is open in terms of, being a travel hub, being a tourism destination, and so on and so forth. And hence, the level of vigilance have to stay, even if most of the people who reside within UAE are vaccinated.
Thank you. So fingers crossed, and I would say the more people and the faster we get to take each of us the vaccine, the faster we reach that normal again. I think with that, let's start talking a little bit. I thought we're getting a lot of questions, and a lot of them revolve around, the vaccines, their clinical situation. If I have a certain condition, clinically, can I take it or not? Dr. Khan, I will try to maybe project a little bit. We have built in our, within MetLife, our portal where we compare among the top vaccines that we saw were the front runners to the current day. I'll share my screen and we will look a little bit at that table. If you can help us summarize, if you want, a little bit, what are the different types from, if you want, a biological perspective, how they are created. I'll just try to share my screen. What is the difference, let's say, between, a Pfizer, and we're hearing a lot about the different categories of the messenger RNA versus the viral vector versus the Sinopharm's inactivated virus. So can you explain to us a little bit this difference?
Yeah, sure. So as we know, the Pfizer, BioNTech, and Moderna, they used a completely new technique. It's mRNA vaccine. Basically, mRNA vaccine is the mRNA of the virus that codes the spike protein. That's the protein that the virus uses to enter the host cells and cause infection. So basically, this mRNA is formulated in a lipid nanoparticle. When it's injected, it goes into the dendritic cells, our body cells, and is taken up by our cytoplasm. And this genetic code, this mRNA, is read by the ribosome, and that spike protein is made. And that spike protein is presented to the immune cells, and it triggers immune response by making antibodies, huge amounts of antibodies. I locked your screen, so I can talk about the other vaccine that we have available over here in the UAE is the Sinopharm vaccine. And the Sinopharm is basically a killed virus. It's the actual coronavirus that was cultivated and killed by a chemical. It's called I'm forgetting the name. It's a beta propiolactone. It's a chemical used to kill the virus, and that virus, that dead virus that is not replicable, it cannot cause actual disease, is again, transmitted via the vaccine, and the immune cells are triggered to produce antibodies. The Oxford, AstraZeneca, and Sputnik they're both viral vector vaccines. AstraZeneca is made by the adenovirus that actually infects the chimpanzees, and basically it's a replication deficient adenovirus that is genetically mutated the DNA to carry the DNA code of the spike protein. Again, all of these vaccines are targeting the spike protein, and that's the protein this virus uses to enter your cells and cause infection, basically. So basically, when our body produces the antibodies, it neutralizes the, whenever you're exposed to the virus in future, it neutralizes the virus and keeps it from entering inside the cells and infecting the cells.
Dr. Khan, so there is a lot of talk. So basically, if you want to, I don't know what's your views on the differences between, or even to you, Shadi, the differences on the technologies. I've been hearing around a lot about, should we be afraid that the messenger RNA technology, which, as you rightly pointed, instead of taking the actual virus and putting it in our body and having our body create that immunity against it, we go about it completely differently. So in the first version, we're creating, and actually this is where I go back again to your point, Shadi, about the speed of the clinical trials. So on the virus itself, when we are injecting the virus, I think the idea is that we're producing the virus outside of the body, and then we're inactivating it and we're injecting it inside of the vaccine. Versus the messenger RNA is a piece of genetic code. We're putting it in our bodies and we're allowing our bodies to create, if you want, this spike protein, as you mentioned, the doctor, which is what maybe we can think of as the weakness point for us that we're attacking the virus with. Now, a lot of people are praising the messenger technology, the messenger RNA, because it's faster, because it allows us to become much faster and more flexible. But at the same time, we're hearing that it's newer versus more traditionally tested methodologies like the Sinopharm. What is your view on this? Do you have any, personal fears from a clinical perspective, from a health expertise perspective on this one?
So yes, everyone is afraid when a newer technology is used. Yes, as Dr. Shadi mentioned earlier, these vaccines were, when they were in the clinical trials, they were rigorously tested, and it just doesn't end there. Like you mentioned, Nancy, WHO, CDC, FDA, everybody they're monitoring the effects of these vaccines and seeing that if there is any adverse effect or not. So these were huge trials. Typically, a vaccine is tried in a phase 3 trial. There are about 20,000 people enrolled, but in these vaccines, Moderna had like 30,000, Pfizer had 40,000, above that, and Sinopharm also, millions of people have received it. The Pfizer and Moderna, about 68 million doses have been received already since December over the globe, 36 countries to be exact. And the U.S., 23 million people have received the vaccine, Pfizer or Moderna. So, if typically when we see a side effect of or an adverse reaction, we see that within the first few days, like Dr. Shadi mentioned, it's been since December. So far, it seems safe. Scientifically speaking, mRNA is basically, it just stays in the cytoplasm. It never gets to the nucleus, so it does not change your DNA. So, some people have been asking. And, it gets, after it does its job, after it's translated by the ribosome, it disintegrates, it disappears. So it doesn't linger in your body forever. So I don't foresee scientifically, and after looking at the epidemiological data so far, these vaccines are being monitored like a hawk. Their databases, everybody who receives the vaccine gets a particular code. Their demographics are entered. So if there is side effects, it would be out and about. And people talk about every little thing in the news. So we would know by now at least.
I'm sure as you're speaking, a lot of people are wondering about, the cases that were, the few, I would say, the decimals and decimals of percentages compared to the 70 million vaccinations still there that have happening. Actually, yesterday, just night, the New York Times released a reported number globally of close to 69 million around the world already took the vaccine. So that's quite a human experiment and large numbers. So I would say it's normal to see some minor reactions. We're going to talk a little bit more about what few cases have, we heard about here and there. To talk a little bit, if you want, one more point I wanted to share about the messenger RNA technology, and maybe in the defense of the idea that it's new. It's actually maybe new from a on-the-ground perspective, so we are putting it in the hands of many people for the first time. But there are years and years, and there's a really good article in Harvard Medical School or School of Public Health on this, shedding the light on all the years and the different challenges that this technology went through over the last 30 years. I would say not challenges, but how it removed the hurdles, if you want, and all the research that was done around it. So even more over than 30 years, I would say it's all the 500 years of science that led us to be here. That's what sometimes we fail to see, and we say it's the first time, but it's a lot of work from the scientific body behind the scenes to reach this stage. Of course, it's a big human experiment, but if I would voice my, if you want, my positive take on this, if we don't trust science in our time, I think that's a big problem we would be having. To your points, Dr. Shadi and Dr. Khan, I think the trust gonna be there. And I think it's really the wisdom of the crowd collectively. What about, let's talk a little bit about clinical points here. So everyone, I think by now knows that we have to take 2 doses, separated maybe by 21 days for the Sinopharm, right? And Pfizer, is that the same for Pfizer, or is it a bit different? Dr. Khan?
21 to 20.
Yes, go ahead. So yes, the Pfizer is 21 days apart, and then the Sinopharm it can be given 21 to 28 days apart.
And after how long would I be protected as a person who got vaccinated?
So generally speaking, almost 28 days or 4 weeks after you receive the initial dose. Your body should have enough antibodies to protect you, if not completely, then partially against the virus.
Okay. And why are we excluding kids to start with, and then we can talk about other groups? We know that we're going, sometimes we're going in phases, obviously with higher risk, but there is a clear exclusion on kids. Why are kids excluded? And maybe we can also talk about pregnant women. Why is this group in particular excluded?
So yes, in general, kids and their immune system is different. They can't be treated as mini adults, So in most of these trials, whenever a new drug is tried or a new vaccine is tried, typically, in the phase 3 trial, there's the de-escalation of the age limit, which is already being started with the Pfizer vaccine for, they're de-escalating the age limits. I believe Sinopharm also, Dr. Shadi, correct me. I'm not exactly sure of what the age limit they have de-escalated to. But yes, so kids are now being included. The fear is certainly, this is basically even if it's an mRNA vaccine, you're introducing the spike protein, a piece of the virus, which actually cannot cause an infection. But you don't know how your immune system is going to react. So kids are a little vulnerable population. So it's just the standards of all the vaccines, all the medicines. You have to follow those. So certainly they will be included, but with gradual de-escalation of the age. Pfizer, I think it's age 16 and above. It's approved under emergency authorization, and Sinopharm also age 18 and above. Mrna age 18 and above. Yeah. And speaking of pregnant, that's a whole big, whole new story. This is also a pretty vulnerable population. It's actually it goes back to the time when when there were in history you might have read when there was this drug thalidomide introduced and diethylstilbestrol. It was given to mass populations, and thalidomide was used in pregnant women for hyperemesis. And all of a sudden, there were thousands of babies born with birth defects. So after that, according to, with the laws and the strategies of, administrative constraints, there were rules passed to be cautious about pregnant women and, whenever you're trying a new drug or a new vaccine. So that's the only, but, science, as we go in the future, this stigma of being a vulnerable population is that we're tending to, go away from that, and in general, American College of OBGYN and CDC is now recommending that they're recommending that pregnant women should be included if they are at high risk, they should receive the vaccine. Certainly, you want the risk of having the disease and having morbidity and mortality from the disease is much higher compared to when you see the safety of the vaccine. It seems pretty good. So, yeah, the data is being collected as well.
I think here in the region, we're still, the group of pregnant women is still being excluded, and we're saying that, sometimes. Obviously, it all goes back to a discussion between the patient and the doctor. If they have a very specific case, maybe they can talk to their doctor. But in general, the guidelines remain exclusion criteria. Maybe we can jump to start taking. We have a lot of questions. I do have a lot more, but I would like to include our attendees with us. Since we're talking about pregnant women, we also, I think there is also an exclusion criteria if women are looking forward to conceive in the next 3 months or so, right? So if you are planning to also get pregnant, not just if you are pregnant, I think you are being recommended not to take the vaccine, correct?
In the UAE, I believe that's the case, but in states, that is not in the questionnaire for the vaccine. They just ask if you're pregnant or not, but not if you're planning to become pregnant. That's not a question.
Right. I think in the UAE, if you call, and I'm not sure about the other Gulf countries who are with us today, but in the UAE, definitely, let's say if you call the DHA line and you go through the selection criteria and you answer if you are looking forward to have a child in the next, or to get pregnant in the next period, they will tell you that you are in the exclusion. So that's an interesting also position we have. Someone is asking us if MetLife will arrange to provide the vaccine. So at this stage, I would say the vaccination drives are happening really at the government level. What we're trying to do is to facilitate as much as possible from a knowledge perspective and education perspective. We're yet to see how public-private partnerships or this partnership stands in the next few weeks, and we will take it from there. Again, at this stage, the vaccination is free from a coverage perspective. It's covered by the government, and it's rolling on voluntary basis. So I would like maybe to address a little bit the logistics factor before even jumping into the questions. I know a lot of people have been, contemplating taking the vaccine, but have not yet gone into understanding what is the process, what should we do. So if we talk today, we have, if you go on the portal that we have shared with you, and we will share it after also this webinar, we have put in this portal the logistics, if you want, for different countries, whether UAE, whether Oman, Bahrain, Kuwait, or Qatar. Technically, what we're trying to do is to share with you the government links, all what you need to know, whether you go, to the HA or to Sahha Link or to the Qatar Health Authority and every governmental authority that is handling the vaccination. If I would speak maybe a little bit about the UAE, since I know there's a large population with us here. So the UAE, as you may know very well by now, we have 2 types of vaccination. Another country also has this, which is Bahrain. Otherwise, most of the other Gulf countries I mentioned are working with Pfizer. For the UAE and for Bahrain, we have the Pfizer and the Sinopharm. So the Sinopharm in the UAE is being given for all the community. You can go at facilities across the country, whether the Abu Dhabi, Dubai, and the Northern Emirates. And you can go as a walk-in patient, or you can go as you can take an appointment. So taking the appointment will happen on the Sahha app. Or you can just walk in and take the vaccination. You will see all the links for the medical facilities on our website. And for Pfizer in particular, which means only in Dubai, Pfizer, as you may be well aware, is not being given so far for all of the communities. So if you would like to take a vaccination, in the next, I would say, foreseen time, a week or 2 from today, Sinopharm remains your option unless you fall under the first stage criteria group, which is what we know by now as the high-risk group, whether the elderly group above 60, the frontline workers, people with determination, and people with chronic diseases. More information on this, you will get it if you either call the HA or you download their app and you go through their symptom checker. So we will not go into too much into these details because these criteria are being defined on the government level, and I would say are changing sometimes on a daily basis. So really just follow that process and it will take you to the answers from there. Any thoughts, Dr. Khan or Saleh, before we jump into answering more questions?
I think many of the questions are really interesting. There have been many people asking about which vaccine would I take. Unfortunately, I live in Lebanon where we do not have the vaccine yet, but if I was in the UAE, I would take whichever vaccine comes first. Any vaccine that has an effective rate that is higher than 50-60%, I will take whatever is available. So that's the short.
So Shadi, you're not afraid of the vaccine, no matter what, no matter the brand. That's what you're saying, right?
Yeah, as long the ones that are available in the Gulf and UAE specifically, I'm really impressed with. Pfizer is 95%, but even the Sinopharm, remember that although they reported a lower percentage, the actual results from UAE put that at higher than 80%, which is very, very impressive.
Yeah. We're getting obviously a question that we would proactively need to answer, which is the side effect. So all facts said and mentioned, just like I would say any medication out there or any clinical product that we put in our body, there is always potential for our body to react in a certain way, although I would say it's very minor, especially that we have tested it on thousands and millions of people. So what could be some of the side effects that we are expecting? I know when, for example, you go to the center, they ask you if you have been allergic, if you have any allergic shocks in the past to vaccines or other. What are some really acute things we need to be aware about? And what are other less, let's say, more common symptoms that people are seeing when they take the vaccination?
So most of the side effects are, like you said, minor. You know, you would have local reaction at the site of injection for the first couple of days. Some people would have low-grade fever, fatigue, chills, headaches, nausea, vomiting. Some people might experience some lymph node enlargement, which is actually a good sign because your body immune system is triggered and you're developing immunity. There are certain rare things that are mentioned. One of the most important things is you must have heard, you know, the severe allergic reaction that is anaphylaxis with the mRNA vaccines. And it is still being studied whether if it is the vaccine component or the polyethylene glycol that is the carrier of the vaccine. So in general, we're in the questionnaire also, it's being asked if you are allergic to polyethylene glycol or polysorbate, then you will be exempt from it. And if you've had a severe allergic reaction to a vaccine in past, so those would be the things. And typically these centers are equipped with epinephrine and you know, all the hydrosteroids to, if you were to develop any reaction, they would take care of it, and EpiPens, of course. Another reaction that was seen in Mrna Vaccine with the people with dermal fillers, you know, there was a little bit of swelling that was also self-limiting, lasted a couple of days and went away. Other than that, it's generally considered pretty safe, you know, all these vaccines. We haven't seen any long-lasting effects. Typical side effects, they last about 3 days and then they go away.
Yeah. And, you know, I've been also hearing from friends or people who took it. Some people, they tell you, I'm tired, I was tired for 2 days, and then things went by. The usual, right? Like the usual as you would get with a flu shot, or maybe I would say we all got the vaccines when we were at a younger age. We never even, you know, thought about it or argued about it, like of the polio and, you know, the measles and all the necessary vaccinations that still run today that are mandatory for kids. Can I take 2 vaccines? Can I take the Sinopharm and after that take the Pfizer?
It's not recommended that you interchange vaccines because they are different, and you should stick with one course. If you took Pfizer the first dose, you should complete with Pfizer, and vice versa, you know, Sinopharm then complete with Sinopharm.
Okay. And what about if someone is they took the first dose and then they got COVID? Will they have to stick to the 21st day, or will they need to wait after that?
That's a good question. CDC recently revised the recommendations on that. So yes, if you got the vaccine, the first dose, and you developed an infection, then it is advised that you continue with your series as it was planned. You should be fever-free. You shouldn't have any symptoms. There is a grace period of 4 days, but it can be postponed a little bit. But it's advised not to skip the second dose. Go ahead and get it, even if you have had an infection.
How long, if let's say you had a COVID, if you had a COVID and you would want to take the vaccine, on average, how much are we waiting? Is it like a month, 40 days, something like this?
So initially it was proposed that you could wait 90 days, that as it was thought that, you know, after a natural infection, you would have immunity that would last that long and you're less likely to have a second infection. However, now the updated recommendations are that you, once you have completely recovered from your illness, you can go ahead and get it. Yeah, that's a new recommendation.
Interesting. So no symptoms, you can take the vaccine, irrespective of the timeline, right?
Yes, that's correct.
But
great.
Also, you know, we all know
just to add, in many countries, those who already had COVID-19 are not considered a priority group for, as Dr. Khan said, for at least 90 to 120 days. So even if they were in one of those groups to be vaccinated first, they are pushed down the line. And there's an interesting question on whether if you take a vaccine, is it safe to travel? Absolutely, it's safe to travel as long as you had both doses, waited a little bit, but you still have to have, the precautions of the physical distancing and masking and so on and so forth. And even for countries, another question, for countries where Sinopharm is not approved, it's important to note that not every country that you travel to has to have approved the vaccine that you have taken, right? So once you are vaccinated with a vaccine that has been approved, WHO and so on and so forth, then definitely you are considered vaccinated. But there are no restrictions currently on vaccinations and travel. So that is, I think, a question that is not too relevant at this point. So you can still travel even if you are not vaccinated, as long as you do all.
Dr. Shadi, since you're with us, do you think this would be enacted as a policy? The requirement to have like a passport of the vaccine if you're traveling? What's your view on this?
No, absolutely not, because that means that most of the countries that are poor and not able to introduce vaccines to their population, they will be prevented from travel. So no, it will be probably what will happen is that it will be an either or. So either a proof of vaccination or a negative PCR. But it's not only vaccination.
Right. We forgot about the PCR. We're now all eyes on the vaccination. We forgot about the PCR. Thank you. I would also like to address the topic of, we also heard a lot about cancer patients, Dr. Khan, or immunosuppressed patients. What is, obviously in this case, I would say they would need to align with their doctor because they would be on a course of a treatment or, constant check-in with doctors. What is your view and advice on this?
So immune-compromised people are a vulnerable population anyway. They are at higher risk of having a severe disease. So it's advised that they should go ahead and get it. In the trials of the mRNA vaccine, immune-compromised people, there was a population with HIV, although granted it was controlled, and hepatitis, they were included. And so in general, it's considered safe. These are, Sinopharm is a dead virus. It's considered safe. mRNA does not cause disease, so it's considered safe as well. From safety standpoint, it's completely safe, and they should actually get it for sure.
Thank you. A lot of questions about which vaccine is better. I would say obviously it's a personal decision, it's a personal choice. We go back to Dr. Saleh's feedback that any vaccine is better than no vaccine. I don't know if anyone would be able to answer which one is better, or whether it's the objective of this panel. But obviously a question on the mind of all of us.
So if I just add to that, just to put people at ease, if you were in the fortunate position of having the ability to choose between the two, it goes back to a personal choice. Again, the pros and cons of everyone is each of the two vaccines are clear in terms of storage, refrigeration, using of the mRNA versus deactivated virus, the effectiveness. So it goes back to a personal choice. I had colleagues and friends who are physicians, infectious disease experts, and each one of them have decided to take a different vaccine based on personal choice, So go where your heart is.
Thank you. If I'm suffering from allergies like sinusitis before my second dose, is it still okay to go and get the second dose?
Yes.
Thank you. straight up. Okay. We have also a question. I think the reason I would like to answer is because it covers autoimmune disease. If I have lupus, can I get the Pfizer vaccine or maybe a vaccine in general? What about autoimmune diseases?
Yes, it's although there is a lack of data in this area, but in general it's considered safe for you to go ahead and get the vaccine, both Sinopharm or the Pfizer vaccine. I've had questions about, people who have had Guillain-Barré syndrome, can they get the vaccine? Yes, absolutely, they can get this vaccine. The Guillain-Barré was associated with flu several years ago, and the incidence was so low, it was 9 in a million, and actually 8 in a million. So so far there's no data, there's no evidence of Guillain-Barré syndrome or inflammation or, exacerbation of autoimmune disease with these vaccines.
Thank you. So we have a question, actually, a logistic question that I would personally like to answer because, many people are actually trying to get it, which is in the UAE, in Dubai in particular, your medical record number, the MRN, which you will also find information available on our website and more also on DHA. So if you are trying to book your appointment for the Pfizer in particular, you will need to book it either by phone calling the HA or by the app, and you would need to have your medical record number available, which is basically your unique health record with the government. There are two options. There are options. Sometimes you would have that record number available. Most of the people would not. The way you would have it is probably if you had visited in the past a public health facility like Rashid Hospital, a public hospital. Otherwise, you would not have it. So how do you get it is a very common question. There is a website on the HA, a portal where you can go and try to put your Emirates ID number, and from there they try to validate your data. They send you that record directly on your phone. However, I would like to share some, also challenges. Sometimes your phone number is not exactly what you would have today. So the bottom line is basically you can simply email DHA by sending info@DHA. We have that email on our portal, and you will share with them all the information about you with your Emirates ID and visa and everything, and they will be sending you this back so that you can use it to book. But that's particularly for the Pfizer, and if you are eligible, I would say for the Pfizer. Otherwise, keep waiting if you are planning to take the Pfizer until the next phases would come. My wife has delivered a question, a child 5 months ago, and she's breastfeeding. Can she take a vaccine?
Again, breastfeeding is, I think, one of the criteria over here in UAE. They don't, it's an exclusion criteria over here. We don't have enough data on breastfeeding, but I know in states people it's their choice, and they're given a choice and they can consult with their physician, and they are getting it. They're getting enrolled in a data monitoring system, and in general, so far, no adverse effects have been seen. But again, over here in UAE, I think breastfeeding is an exclusion criteria for the vaccine.
It is. I can confirm that if you call actually on the DHA line, you will be excluded. There's a really simple, by the way, approach here. I don't want to just, talk about Dubai because I know we have people from other countries, but the process, I would say, even if you look online, there are some people who went and took the vaccines in different countries and they wrote about them, whether on the national, Gulf News, etc. The process might be much easier than sometimes what we have in mind. And as we address, I would say, the government and the doctors at the facilities, we will get all these answers. So it's really about just taking action, knocking the door, and hearing the answers there. I think with that, so we definitely exceeded our usual time for a webinar. I think we answered a lot of questions. We got through the Q&A. I will not be able to answer more. However, please, if you want, we have a portal that also is addressing FAQs. With that said, Dr. Saleh, I would like to be any final thoughts from your side on this topic.
So I just want to say that definitely 2021 will continue to be a challenging year. So we should not let our guard down this year, even with the vaccination, because remember that until we reach herd immunity, we cannot be 100% comfortable with, having life as it used to be, or at least close to that. So definitely we should remain vigilant, even if we as individuals have been vaccinated, until we hit that target of herd immunity. And I would like to thank you, Nancy. I would like to thank, ECTA, all of the team for all of their help, support, and for the kind invitation. A pleasure also to meet Dr. Khan and, have all of the, attendees.
Our pleasure to have you with us, Doctor. Thank you for all your insights. And Dr. Khan, also, I know we took you from the emergency room and the front line, and you're dealing with COVID cases. We know that the current situation is not very easy. Any final call, whether as a frontline worker or a public health expert, to to our community?
Yeah, I would second Dr. Saleh in the fact, don't lower your guard. It's very critical. The entire world has suffered. It's been equivalent impact to the World War II. It's been a very challenging year, and we don't foresee, if we don't take caution, we are fortunate that we have vaccine. We should take everything precaution by preventative measures, including the vaccine, if we can, to be a part of, attribute to protecting the world from any further damage this virus has caused. So we just hope, coming days would be better, but we're still in the midst of the danger zone. We're not out of there yet.
Agreed. And I would voice also the same concern. We gotta keep doing what we're doing and carry forward. Trust, all the measures that we've been taking. Even more aggressively take them and focus on the way forward, which is the vaccination. Thank you both for today. I would like to thank everyone who's still with us and have a great rest of the day. Thanks, doctors.